Okay. Good afternoon. Thank you for joining us for this community briefing. Joining me again is interpreter Margie Propp, and thank you, Margie, for being here to provide your services. We want to encourage everyone to visit our website at covid19.lincoln.ne.gov, where you'll find a dashboard with our latest COVID-19 data, as well as our risk dial that forecasts the risk of spread of COVID-19 in our community. For the third week now, we remain in the mid-yellow range, indicating moderate risk. And to help keep the risk of spread moderate, we are asking that everyone continue to protect ourselves, our families, and our neighbors by following what the former director of the CDC, Dr. Tom Frieden, calls the 3 Ws. Wash your hands, wear a face covering, and watch your distance, keeping 6 feet between yourself and others. In our situation update for today, I want to report that we have had 27 cases of COVID-19 reported over the weekend, and today in Lincoln, an additional 21 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,718, and our total recoveries identified to date are up from 547 on Friday to 599. Just as a reminder to track recoveries, our contact tracers follow up with people 28 days after the date our health department first receives reports of their lab-confirmed cases of COVID-19. If these individuals have returned to their normal health status, we consider them recovered. Here now to provide additional details and an update on our indicators is Health Director Pat Lopez.
Thank you, Mayor. I want to start today with some good news about our hospital capacity. On Friday, we had 21 COVID-19 patients in our Lincoln hospitals. Today, our hospitals report just 12 COVID-19 patients hospitalized with 2 on ventilators. This includes 7 Lancaster County residents and 5 patients from other communities. I do need to bring attention to our biggest concern right now, and that is this month's increase in cases in the under 40 age group that we discussed last Friday. At the beginning of May, this age group accounted for about 40% of all cases. Now, the under 40 age group accounts for about 65% of all cases. And last week, 73% of all new cases were in the under age 40 age group. 25% of last week's new cases were under the age of 20. As we told you Friday, our investigators are hearing many individuals report that they went to bars, attended social gatherings, went camping with large groups, or had taken part in team sport activities with no masks or face covering. We want this younger age group to realize that this virus is still very active in our community. We risk contracting COVID-19 anytime we are out in public. This is not the time to get complacent and abandon the precautions that have helped us to flatten the curve and avoid overwhelming our healthcare system. Overall, a total of 26,575 individuals have now tested for COVID-19 in Lancaster County. As of today, the overall positivity rate of all these tests is down from 6.6% on Friday to 6.5% today. The positivity rate for the state is now at 10.8%, and the national rate is 9.9%. This month, we have seen the number of tests level off with about 2,500 COVID-19 tests completed each of the 3 previous weeks. This past week, ending Saturday, June 27th, we did see an increase to about 2,750. But it's important for the public to know that testing is available and we have the capacity to do more. We strongly encourage people to sign up to get tested if you have symptoms of COVID-19. You can do this easily by contacting your doctor or filling out a risk assessment at chihealth.com or bryanhealth.com. Test Nebraska has expanded COVID-19 testing to all Lancaster County residents, so anyone in Lancaster County can be tested even if they have no symptoms. Test Nebraska is available in Lincoln this week on Wednesday and Thursday at North Star High School. The hours are 8 a.m. to noon and 1 to 5 p.m. You can begin the process with a free online risk assessment at testnebraska.com. All the testing at CHI Health St. Elizabeth, Bryan Health, and Test Nebraska is by appointment only. We are continuing to offer additional testing with minority populations, particularly for those with English as a second language. The Health Department will hold a free testing event this Tuesday evening, tomorrow, June 30th, from 5:30 to 7:30 p.m. We are especially encouraging members of our Hispanic community to participate, although this testing is open to all, even to those who have no symptoms. The testing will take place on the south side of our offices at 31st and O Streets. This is the parking lot next to Woods Park. Registration is required and can be done by calling 441-8006 for an appointment time. We will continue to plan these events for specific populations in the future. Another issue we want to discuss today is summer travel. As you know, we are seeing many states currently experiencing record highs with new cases. Those include California, Arizona, Texas, and Florida. If you are planning to travel out of state this summer, we strongly suggest that you consider alternative plans. Travel does increase your chances of getting and spreading COVID-19, and we don't know if one type of travel is safer than others. However, airports, bus stations, train stations, and rest stops are all places travelers can be exposed to the virus in the air or on surfaces. These are also places where it can be difficult to stay 6 feet away from others. The CDC website, cdc.gov, provides guidance to help protect you and your family depending on the type of travel you are planning. The CDC's website travel advisory page can also be a resource as you plan your travel. There you can review your destination and compare it with a map which shows high-risk areas. You can click on a state, and a map provides the number of cases they have had over the past 7 days. We need to learn from other communities that are experiencing record high spikes and new cases. They have opened up more. The lesson from these other communities is that we all need to continue to support each other. If Lincoln is going to succeed in minimizing the spread of COVID-19 as we loosen restrictions, we must all follow these steps. Get tested. Testing is available to anyone in Lancaster County, as we have mentioned. Just visit testnebraska.com to schedule an appointment. Practice physical distancing and avoid locations with crowds of people. Wash your hands regularly and carry hand sanitizer when washing isn't available. Finally, be a hero and wear a mask or face covering when you're around others, especially when you can't maintain at least 6 feet of physical distance.
Thank you, Director Lopez. We know that during interactions, the best protection against the spread of COVID-19 comes when both people involved in that interaction are wearing masks. To promote the importance of wearing a mask, our health department and city communications teams have been working with the Lancaster County Medical Society. We are especially grateful to Dr. Bill Johnson, who has volunteered his time and expertise to help with this project. He is a pulmonologist with Bryan Health, who is board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine.
We know COVID-19 is spread person
Together,
to person,
we have created a new
means
public
we really
service
have to be
announcement,
careful in public places.
and I'm happy to launch it today. Let's take a look at that now.
We know COVID-19 is spread person to person, which means we really have to be careful in public places. Protecting your health and reopening businesses can occur together. We just need to work together. Wear a mask in public places. Keep a 6-foot distance. Wash your hands well and often. Let's all do our part.
We'll be seeing on social media. And here are the graphics. More evidence of the importance of wearing masks was just published in The Lancet, a well-known and respected medical journal. The findings were drawn from a systematic review of 172 observational studies across 16 countries and 6 continents. It provides the best available scientific evidence that the use of face masks can reduce the risk of coronavirus infection by 80%. Let me repeat that. Wearing masks can reduce the risk of spreading the virus by 80%. Masks are now widely available, and we have more information posted on our COVID-19 website. If you click on the How to Help tab at the top of the page, you will find answers to frequently asked questions, face covering information in multiple languages, and links to learn how to properly put on and take off your face covering. You'll even find instructions on how to make your own. And once again, for that under 40 crowd that is now contracting the virus at a higher rate, please keep in mind that you could be an asymptomatic carrier of the virus. That means that you could spread coronavirus to someone you care about who is much more susceptible than you are to the severe impacts of COVID-19. And this is why it's so important to recognize that we wear our masks as part of the social contract. I wear my mask to protect you, and you wear your mask to protect me. It's an act of community, an act of protection, and an act of love. In short, it's an act that anyone can embrace. And in the spirit of honoring our community and protecting one another, let's next talk a little bit about the upcoming holiday weekend. As we celebrate our nation's independence, we are called upon this year to consider the ways to safely celebrate the 4th of July beyond the usual precautions of keeping a safe distance from bottle rockets and other firecrackers. Today, we offer some additional tips that can help protect ourselves, our loved ones, our neighbors during this pandemic celebration. Our health team recommends that for the 4th of July, we do avoid large gatherings with people outside of our immediate households. Remember that the more people you come into contact with, the higher the risk is of getting infected. If you are hosting a small gathering at your home, please consider precautions to make it safe for everyone. One tip is having everyone bring their own food and utensils. This means not sharing that bowl of chips. Hot dogs and hamburgers can go directly from the grill to a person's plate, not to a big tray of food. And different households should ideally sit together but separately and 6 feet apart from other groups and other households. The gathering should be outdoors ideally, and guests should try to stay 6 feet away as much as possible and wear those masks except while eating. Having hand sanitizer on display for all of your guests is another way you can show your care and concern about keeping everyone safe. And you can think about it this way. You can best celebrate our nation on its birthday by protecting yourself and others. And finally, we've been sharing art from children on Tuesdays as part of our Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. If your family would like to participate, you can send your scanned notes and artwork to sunshinekids@lincoln.ne.gov, and we have some other examples here for you to see today. And we just ask that if you submit art, just to put your child's first name only on the artwork. And with that, we're happy to open up the briefing for questions from the media. Any questions today? Going once, going twice. Oh.
Hi, can you hear me?
Yes, hi Brent.
Hi, I have a question for Director Lopez.
All right, she'll be right up.
Hi, Brent.
Hi, Director Lopez. You reiterated again today the concern in the large amount of cases of people under 40, and you highlighted some of the places they had been, such as bars and things like that. Do you have any insight as to how many of those cases might have been the result of people who attended the recent protests?
You know, I don't, and that is something that we've been, we ask where people have been, and so if they didn't share it with us, we wouldn't know, but in general, people are pretty open about where they've been and where they've been exposed. And one of the most common things that we're hearing about is bars right now. So just, that's one of the areas. We haven't had very rarely anyone who participated in the protests.
So you've heard from some, but not a large number.
No.
Okay, thank you.
Mhm.
Director Lopez, this is Andrew Ozaki from Channel 7 News out of Omaha. Do you have any indication as to how many of that age group of 34 and under are actually getting tested?
You know, Andrew, I can't really respond to that. We were checking on some of those numbers because we have to go back and look at the demographics of our community and then do a comparison. So we are working on that. I know you had an interest in that.
It sounds like a lot of people don't want to come in and get tested because they don't think they have symptoms, or they don't believe they've been in contact with anybody who has tested positive. What are the guidelines, or what would you recommend to that age group as far as signing up and getting tested?
You know, we haven't had that people, I wouldn't necessarily categorize that people aren't getting tested. I think one of the important things is that testing through Test Nebraska is open to anyone. They don't have to be symptomatic, and that's something that we keep stressing because, as you know, for so long, we had such few tests available that we were really stressing they be for those individuals that were having symptoms. It could be that some of the young people are asymptomatic, or they think they're having allergies or other things, just like other individuals who test positive. So we really are encourage anybody that has any symptoms or any concerns to go in and get a test.
And when you look around the country with what's happening in some other areas, how important is this particular age group as far as, I guess, the community spread?
Well, I think it's really important for them to get in and get tested and with the community spread, because you think about if you're a younger person, you're probably interacting with your parents, your grandparents, or others who potentially could be greatly impacted by having COVID-19, even though the younger individual may not experience a seriousness of response to the COVID-19. So it is critical, especially as they're out more and in large gatherings. I think it's important for them to know about their health status and to make sure they're protecting their loved ones.
It's also important, just to follow up on that question, it's important as we work so hard to get kids back in schools. I mean, the underage 40 group also includes our school age population, and getting them back in schools is so important for their mental health, for their academic growth, for our economic recovery, so that parents can get back to work. The same goes for wearing masks. Wearing masks and getting tested, these are all just ways that we can work to prevent the spread and keep infections low in our community so that we can get back to that sense of familiar daily life that we all want so badly. Any other questions? Okay, with that, thank you so much for tuning in to this community briefing. We'll be back tomorrow and later this week with additional news. Thanks so much.